Mental professionals of Reddit, what is the worst mental condition that you know of? Though not a medical professional, during my brief time working at an outpatient facility, I encountered a patient with body integrity identity disorder, BID, convinced that his arm wasn't his own. He consistently described it as feeling like a stranger's limb. His intense desire to have his arm removed led him into a deep depressive episode, culminating in a self-mutilation attempt that ultimately needed amputation. Post-surgery, he claimed to finally feel sense of peace. However, I left the job, so I don't know the lasting impact on his mental state from the surgery. BID is still a relatively unknown identity disorder and doesn't have many treatment options so far. SSRIs are usually given to alleviate depressive symptoms, but it doesn't always seem to help. Going through something like that just seems like an awful experience. Dealing with those obsessive thoughts non-stop? That's gotta mess with your head big time. Prosopagnosia. I had a patient with this as a therapist. They reported to the ER because their face fell off. The only thing therapy could accomplish was to teach patient how to use other markers to identify people. Kagras syndrome. The idea that the people around you were replaced with imposters. This one is absolutely hell on everyone. And in neuropsych, definitely primary progressive aphasia. Basically, you aggressively lose the ability to speak and understand language. I had a patient once that was late to their appointment, and when they finally got there they were pissed because none of the signs were in English. They failed all of their language tests but passed all the other markers to rule out dementia. This person was an avid runner, vegan, perfectly healthy, and would likely go on to never be able to speak or understand anyone speaking to them within 5 years or so, yet live a long life due to no other health concerns. Have a friend who works with seriously disturbed patients, and told me about a woman that habitually drank hand sanitizer. Apparently when you do that, your joints lock up and you have to be immediately rushed to the ER for treatment. And what do they have in the ER? Every 10 feet or so? Yeah, more hand sanitizer. So this woman would have to be restrained. Otherwise they would find her in the hallway pumping it directly into her mouth all over again. I heard about a guy who thought he was on fire all the time he was awake. So he screamed until he passed out, day after day. How can you even treat that? More adjacent to the field, but one person who compulsively ate glass. They'd break light bulbs and windows just to have something sharp in their mouth. They'd be at the ER every month. One person who ate dirt. They would pack so much dirt into their mouth until they could not breathe. One person who was in the system since adolescence. They would compulsively have sex with whoever. At 18, they started sneaking out their window, undressing outside of the facility, and offering themselves to homeless men. Yeah, I look at the world differently now. Schizophrenia. Hands down. No contest. 90% disability rate. 30 years shaved off of natural life expectancy. Astronomical suicide rate. Common comorbidities include both mental health and physical disorders. Some people still think schizophrenia is dead, which, obviously it is not. Multiple personalities. But a less ignorant yet even more common misconception is that schizophrenia is a monolithic disease. That is, it shares an underlying pathology between cases that causes it. The reality is that schizophrenia is nothing more than a cluster of symptoms. And there are many different pathologies that can lead to those same symptoms. Part of the reason schizophrenia has a reputation for being the be-all and end-all of insanity. You cannot go more crazy than schizophrenia. It does not exist. Schizophrenia is the end of the road for all madness. I have a friend with schizophrenia and it's hell for her. I'm not a professional, But I have an immediate family member who is a diagnosed schizophrenic and borderline personality. It's one hell of a combo. Delusional parasitosis comes to mind with this prompt. I've watched a patient go to well over a dozen doctors trying to get confirmation that they're parasite-ridden. After countless stool samples, blood work, labs, scans, biopsies, etc., she clearly didn't have any but remains convinced. Honestly, mania. People's lives get ruined because of one manic episode. Thousands of dollars spent, random flights booked, and ending up on the other side of the planet with no way of getting back. I'm not a professional, but after seeing the damage dementia can do, I can't imagine anything else would hold a candle to that. Rest easy, Grandma Hart. I don't have it, but my psychiatrist referred to anorexia nervosa as the 7-year disease because in 7 years from diagnosis you're either in recovery or dead. Anorexia and borderline PD have the highest all-cause mortality risk and suicide risk. Both reduce life expectancy by about 20 years. And if they're in combination with other disorders, substance abuse, etc., even more than that. This is partly because of increased suicide risk, but also due to factors like increased risk of unhealthy lifestyle, the combined metabolic burden of substance abuse and medication, and the effects of constant stress. Also increased risk for bloodborne diseases, STDs, like hepatitis, etc., because of risky sexual behavior. 10% of people with BPD commit suicide. For BPD, this percentage is skewed heavily towards men. 20% of men with BPD commit suicide, but only 5% of women. This is at least partly because men often choose more immediate methods like jumping or firearms. That's not attempts. That's actual suicides. More than 3 out of 4 people, 79%, with BPD attempt suicide at least once in their life. Edited BCI misremembered anorexia suicide risk. Clinical depression. Sitting in a room with someone and you can feel the void around them. It's like a complete emptiness. I worked with someone who accidentally set their bed on fire while smoking and was just watching it. Like they were watching daytime TV. Zero emotion and zero reaction to move from it. It's chilling. Schizophrenia, disorganized, just looks exhausting. Dementias. Watching a person, their memories, their personality die but their body remain living. And confused is horrifying. Locked-in syndrome. I work in the field but not as a clinician. Yet, I find NPD really hard to deal with. You get these charming PPL with absolute destruction in their wake. I work in a ward where you get forced to go and legally can't leave. So we see the extremes of each condition. That's a hard one to answer because everybody is so different. And their experiences of mental illness can be so different. For instance, I've worked with people with chronic schizophrenia with hallucinations so horrendous you can barely imagine, and others who manage the same chronic mental illness with totally different symptoms and a high quality of life. I can definitely think of individuals with particular presentations of mental illnesses I would consider to be the worst I've ever seen. But thankfully not everyone with those illnesses will have that same experience. I mean, worst is schizophrenia because I do a combination of many different mental illnesses. But for me it must be bipolar because I have some family members with bipolar.
If you enjoyed this video, please check out our playlists full of similar content. Epic Aircast is like doom scrolling for your ears. Please like, share, and subscribe.